Welcome to another episode of the Transforming Lives podcast panel. I am one of your hosts, Cheryl Pankhurst.
And I'm Charmin Prince.
And we are here to solve the problems of the world one episode at a time.
Be sure to smash that subscribe button, review, and download. And don't forget to invite a friend.
Let's go. Welcome to the Transforming Lives podcast. Thank you for joining us again. We're so excited and so grateful that you're here to spend some time with us. As usual, we're going to start our first minute or so with just mindful grounding. Bring yourselves inward and make this a valuable time spent together. So I invite you to just settle in. Take some deep breaths in through the nose and out through the nose, really extending that exhale, bringing the heart rate down, focusing in, noticing any sounds, noticing the feel of the chair, the feel of your feet on the ground. Can you notice any smell? Is dinner cooking? And just be present here. Appreciate our time together. You've mindfully tuned us in, so appreciate the time that you've taken for yourself and for us as a group. And can you just put away your to-do list and your menu and your grocery list for a few minutes and really have some gratitude for yourself that you are open to having these conversations with us. Just a couple more deep breaths. And just bring it back and welcome everybody here.
Thank you so much, Cheryl. And of course, again, welcome to Transforming Lives podcast. And today's topic is medical trauma. And oftentimes, this is not a conversation that we have. And you may be asking yourself, what is medical trauma? And it is the trauma that we experience after a surgery, after losing a body part. And just like any other trauma, we are expected to recover and heal. And that can take time. And so we will have a discussion, a conversation about that. And with the hope that you are inspired or empowered or even encouraged to embrace your own experience if you have been on that journey also. So I just want to open the floor to our co-hosts to join in this discussion of medical trauma. Go ahead, Mitzi.
I guess I'll jump in there and start. So I had, something that sort of interesting happened. So when I was having my second child, who happens to be 10 months younger than his older sister, and the reason he's only 10 months is because he was born at 28 weeks. So my medical trauma was that I went into the hospital because I knew something was wrong and I was in excruciating pain. And the hospital was just like, oh, you've got indigestion, take some Maalox, go home. It's nothing, don't worry. But I knew there was something seriously wrong. I could just tell, and I wouldn't leave the hospital. And so at one point, the pain was getting really, really bad. And I was trying to call for help, and they actually didn't have the call bell plugged in. And I basically fell off the gurney trying to go and get help. And then they realized, okay, the call bell wasn't plugged in, and they realized some pain and gave me some medication. And then a few hours later, all I remember is this feeling of my whole body shaking, and holding the call bell. And then I woke up 3.5 days later, having been in a coma. So I actually died. They revived me with the paddles. They delivered my son with an emergency C-section. I was in a coma, had blood transfusions and everything. And, that sort of waking up from being out of it for 3.5 days and finding out you'd had a baby on top of it was very life changing. One of the things was there was not the fear of death, having gone through it. There was that realization of how you do hear things, or at least I heard things that were going on around me as if they were off in the very distance. I remember a nurse in particular being really, really kind to me, and how that was one of the first things I felt and heard. She said her talking about the fact that I was covered in blood, and she washed my hair, and I remember the feeling of the running water, and that feeling of kindness of her. And so, from that, I think the thing is really being aware of yourself and defending yourself and not listening. Because if I had listened to the doctors on call and I had gone home, my son and I both would have died. Unequivocally, there is no question. Had we left the hospital, we would have both died. But something in me told me I wasn't going to listen to them, and I was going to fight. And I know that saved my life. And here we are, and he's 21 years old now, and life is good. But so I guess for me, that's that, just really being cognizant and paying attention and fighting for yourself and your loved ones when the medical community isn't listening to you, because no one knows you and your family like you know you and your family.
Thank you, Mitzi. And Mitzi, if I may ask, what were some steps or some things that you did that helped you to recover emotionally or psychologically from that experience?
I think the biggest thing was really focusing in on the fact that I was given a second chance at life, and what a blessing it was. The things that kind of crossed my mind was like, my God, if I had died, and my son had lived, like the guilt that he would have had to carry, and maybe the anger that my daughter would have carried because I died in childbirth with her brother. And so knowing that surviving it meant that those types of things didn't happen, I really just sort of focused in on that going forward. And I'm here for a reason. And there's obviously something bigger and more important that I need to be here for and to do. And that's why I was blessed and lucky enough to survive what I went through. So, I mean, it was really sort of taking that time to kind of think of those things and look at the blessings that came out of it.
Thank you.
Yeah, I'm going to follow that up. I'm glad that you asked that question, Charmin, to Mitzi, because it's really important for people to hear your response as being someone who actually lived a situation like that. And for you to say, I focused on the positive. I focused on what good came out of that. And instead of focusing on the negative aspect, because a lot of people will stay stuck in that era or that phase of life, and it's hard for them to make progress. It's hard for them to forgive. It's hard for them to trust again. And that was an awesome question, Charmin, that you asked Mitzi. And Mitzi, hearing your response, I think it's something that's really necessary for people to hear.
Thank you.
I think too, like listening to you talk about, you made the decision even though they said go home. It scares me, the vulnerability. I think our generation is much better. I don't think they're there yet. But when I think about my parents, and they do everything the doctor tells them to do, they take every pill the doctor tells them to take, they won't try anything natural. And that really frightens me, because they will not second guess authority, and it's passed down. Like I feel like there's some decisions I could have made differently that didn't, and it's funny because well, not funny, but when we started talking about trauma, I was telling Charmin, I really had to think about medical trauma for me. And the first thing that came to my mind was my mom had her colon split, and it was just, I almost lost her just before my wedding. But then I thought, well, wait a minute. So when I was pregnant with my son, the doctor insisted on, oh my goodness, what's it called when you start the inducing. Oh my goodness. So, and that was with like the intravenous drip, and like this is in 1989. And so I said, okay, so I was in the hospital for a week before, and then wound up in an emergency C-section. They had me tipped upside down because his heart rate stopped. All that to say, I came out of the C-section, wound up with an infection immediately. So I didn't hold or see my son for 3 days. And I kept coming out of I was in a fever, like when you get a major infection, you have a fever. And I remember just kind of hallucinating and then coming to, and I would see my dad sitting at the end of the bed, holding my son for 3 days straight. Every time I opened my eyes, not his dad, my dad sitting there. And it did not allow me to breastfeed. It did not allow me to hold my son for 3 days. And it was like, oh, if I had have really thought about it, now hindsight is 2020, your body is going to decide when it's time to go into labor. And unless your baby is in distress, or, I just feel like I think it was, the doctor was on the shift. This was my shift. This is when, they did rounds and they worked for 24 hours. And it was almost like, we got to get this going. We got to get this kid out. We got to get, like, this is my shift. And the next doctor's come. And all of those things come back to me later. And I think, oh my goodness. And now, a lot of women are having babies at home, or they have the midwife, and it's all so different. And you're making so many more decisions for yourself, which I think is so important. But it goes back to this other generation where it's just slowly turning around, thank God. But yeah, it's really scary to me for my older generation to be making these decisions and just depending on, and the doctor's usually as old as they are. So it's, do they have the new technology, the new information? Do they have all of that? Really puts a little worry for me.
Mitzi, are you able to share, or anyone, how are some ways that people can advocate for themselves ultimately, as Cheryl was describing or referring to? What are some ways that people can actually advocate for themselves, for those who may not know?
Yeah, so some of the ways in which you advocate, well, one is I just wouldn't leave. Really that was the biggest one. It was like, okay, yeah, you can go home, and it's like, yeah, not leaving because I know there's something wrong, and like I'm just requesting tests that they were not sort of ready to do, making them look at the results of the test. I mean, one of the reason I went in so far into distress so fast is because even though they did my blood work, they didn't actually look at my blood work or the urine test. They did for many hours. And what happened was, had they would have seen that there was the issue, but they were lackadaisical on it. They were just treating me like, oh, this silly young mom, and she's overreacting. She's got indigestion, for God's sakes, and they were treating me that way. But as I say, like, I knew my body, and I knew that was not the case. And to that end, I mean, even for other people, my husband had some major health issues between 2013 and 2017. And, at one point, he just developed some of a vestibular problem, and he literally, his eyes and ears lost communication with each other. So his body couldn't tell if he was standing up, sitting down, or lying down. So it threw his body into a 24/7 fight or flight response. And basically it was like he had a nervous breakdown. Like, he couldn't function at all. And when we were trying to figure out what was wrong and take him to all these doctors, they're like, okay, your husband's had a nervous breakdown, and you just have to accept that he's just going to be a complete vegetable for them. And it was like, no, I know my husband. That's not what's happening. There is something else going on. You need to find it. We need to keep testing. We need to figure out what the issue is. And just that, keep pushing and pushing and pushing to get that test, doing the research on your own, coming up and giving them the ideas of what to look into, reaching out to anyone you know who has some medical connections and asking for the help and the resources and things. Because I mean, that's what we did in my husband's case. It was a physiotherapist who dealt in balance issues who finally figured out what was wrong with my husband. The doctors didn't figure out. It was a physiotherapist who figured it out finally. And it took a year, and cognitive behavior therapy and a bunch of other things, but he finally got through that. But it like I say, you have to really reach out to your network of people and friends and business acquaintances and advocate for yourself and do research for yourself. But also understand that Wikipedia doesn't give you all the answers, because that's the other thing. People try and self-diagnose everything too, and that can be a problem too.
Yeah.
Or even Dr. Google, because we have access to the internet these days, and oftentimes when we're asymptomatic, we're trying to self-diagnose and identify whatever it is that Google says, and sometimes it helps and sometimes it don't. So I like that you're encouraging our listeners to advocate and to read and conduct our own research. I mean, I shared last week about my medical trauma, but I've had a couple of medical traumas, and one of the things I think one of the serious aspects of medical traumas is the loss of body parts or amputations. There's so many younger women that are being diagnosed with breast cancer and having to have a reconstruction of their breasts, and no one is talking about the psychological, the mental, the emotional toll that these medical conditions or experiences take on the person, the patient. And to our listeners, this is something I want to highlight because it is important for us to take care of our psychological or mental well-being. And we're also recording this episode in the month of May, which is Mental Health Awareness Month. And even though we're talking about medical trauma, our mental well-being during that time is so important, and if not equally important as our physical healing. Because I've always, my body speaks to me in one way. If something is wrong, I have the same symptoms, and I will go to the ER and have a different diagnosis, but I've learned that that's the way my body speaks to me. And so it's important for us to understand when our bodies are communicating with us. And because I'm from a culture where we self-diagnose, it is easy for me to do that, but I've been to the hospital with the same symptoms. Like when I woke up and they told me, okay, we found cancer. And I, like 3 or 4 years, just keep annually going to the ER with the same symptoms. And eventually they found that it was intermittent bowel obstructions. Now, I just want to say this. If you have a hernia and it's not affecting you in any way, you're encouraged to have a surgery to remove it. But if it's not affecting you, you can decide not to have that surgery, because after the surgery, if they put the mesh, there's so many complications that no one shares with us. And then there are additional surgeries after the hernia repair, because I have had the hernia repair because, of course, I don't want the protruding abdomen. And then after that, symptoms after symptoms after symptoms annually, and eventually surgery where, parts of in my small intestine was removed. And it was because of bowel interruptions, intermittent bowel obstruction, sorry. And so we have to be careful that when we have a medical diagnosis, surgery should not be the first option if there are other options. And I think Mitzi said it earlier, that it is so important for us to do the research for ourselves and make the decisions for ourselves. Because if I knew what I know now, I would have kept my hernia and it would have saved me, 2 other surgeries. And no one told me of the mental toll or the psychological effects of those surgeries. So I want to encourage you to research, read. We have the internet. Now we have AI where we have answers at the click of a finger. Let's take some time to research and educate ourselves before the surgeries, if it's possible and if it's not an emergency.
I think you brought up a really good point too, which is really knowing and listening to your body and getting to know how your body speaks to you, because, that's one of the things is it's like, your little voice or what you're here, or sometimes maybe you get that, a feeling in your gut, or maybe it's you all of a sudden develop acne or something, right? Like when we're out of balance, when something is going on and we're stressing, even when we don't consciously realize it, subconsciously and within our body, it realizes it and it manifests in some way. But we have to be working on and learning and paying attention to what that looks like for us. So what it looks like for me can be very different than what it looks like for Charmin or for Cheryl or for Energy or for Katriana. It's because we're all different, and all the little things that we've gone through in our life factor in on how we process and deal with our traumas or with good things. Or so it's learning how to listen to and pay attention. And that's why, journaling can be beneficial too, right? Because when you're writing out, what you're feeling each day, good, bad, then when you kind of go back and you look at it again, all of a sudden, sometimes you can put together those pieces that maybe you couldn't have put together if they were just sort of random and you weren't paying attention. But when you've journaled them out, all of a sudden you can find that thread and identify, oh, okay, maybe this is somehow triggering that or something like that.
So Charmin, what is the process if you've lost a body part to cancer? What is the process between losing the body part and thank God you don't have the body part because now you don't have the cancer, but you've still lost? Like, what is that? What are the steps to healing and kind of validating that for yourself? Do you know what I'm saying? Does that make sense?
Mm-hmm. Thank you for asking that question. Because I think the first step for me was acceptance. I was grateful that, yes, the cancer has been removed. However, I have lost my entire reproductive system. And I have to, my body is readjusting itself. And because there are no manuals to teach us how the body is going to readjust, I have to pay attention to my body to understand the readjustment process. And while doing that, I still have to function day to day and accept that this is what is happening. And I am grateful for being the person I am and understanding these processes. However, this knowledge came after, because during the process, it's survival, for surviving the scars, the physical scars, surviving chemotherapy, you surviving all these different tests that occurs after the surgery. So it was survival, but understanding that this is a new lease on life, and acceptance first. And after accepting and embracing that this is just the card I was dealt with, and I can choose if I am going to be bitter or allow it to make me become a better person. And healing was not easy. It took, I think, a few years later for me to understand that the loss I was feeling and the grief I was experiencing is the loss of that system that I thought that connected me and made me identify as woman. Because it is the one thing that differentiates the genders, and that's what you grew up and you were socialized to embrace and to accept. So losing those parts, as traumatic as it was, I was forced to accept. I was forced to love myself again. Without that, I was forced to identify myself as who I am on the inside and not my body parts that differentiate genders. And that taught me, or give me the permission. I give myself the permission to heal. So when I was exposed to a second surgery and lost another parts of my body, it was not that difficult to accept and heal and overcome and be like, okay, it is my journey and there is nothing I can do about it but accept it and grow from it and help others.
Thank you very much for asking that follow-up question, Cheryl, and expanding on that, Sherman, because I think that really, is a big thing for people, as you say, when you've lost something, that's like what that process looks like. And obviously it's different for every person, but you sharing what that was like for you is really, really helpful. And it got me thinking. A friend of mine had to have her breast removed for breast cancer, and one of the things that she talked about one time was sort of the different circles within your life. And she said, the person who has the cancer is sort of the center of the circle, and then there's their immediate family, their spouse and their children, and then like their parents and aunts and uncles. And she said one of the hardest things for her was, people didn't know what to say, and a lot of people would say things that were really hard to process, or they wanted her to react a certain way or do something. And one of the things that she says is, you have to look at sort of where the person is within the circle. She said, the person who's experiencing it, they have to set what is acceptable and what isn't, and what they're prepared to talk about and when they're prepared to talk about it. And she says, the further out the circle you go, when you're dealing with somebody, like, you've got to connect with them and see what they're ready to talk about. Because again, you go through these stages of anger and depression and acceptance, and everybody goes through it differently. And your extended family, your spouse, your kids, everybody's processing it, but they're not all processing it in the same way. And they don't necessarily know how to reach out and help. And that was a real educational thing for me, was her sort of saying, talk to who you're sort of the next closest to in the circle and kind of find out what they need and kind of use that as your guideline. And always remember that center person in the core has to kind of direct the traffic, so to speak, as to what they're ready to deal with at that time.
That is a common, for lack of a better term, mistake or misunderstanding, that the person who actually went through the traumatic experience, they may get over it quickly, or they may deal with it in a way that may not be as maybe emotional from an exterior standpoint. And sometimes I've seen where for that person, they may look at their other family members, typically a spouse or a partner, and say, well, why are you bothered? I'm the one that went through it. You didn't have to go through anything. And that is so not true, because they experienced that same traumatic event just in a different way. And I like the way that you described it, checking in with each person to see where they are and how they were affected, in order to just really understand what they may need moving forward to help them deal with, what their relative or their partner or their family member just went through.
Yeah, that's a really good point. And when my husband had his illness, it was a very weird thing. I mean, he had several different illnesses all going on at the same time, so they were trying to figure out what was wrong. But the vestibular one in particular, I mean, he couldn't handle any kind of sound. So for the rest of us, like, we couldn't have the TV on, listen to the radio. We couldn't make popcorn because his body interpreted, like, my son one day made popcorn and my husband was upstairs and my son was in the kitchen making popcorn. But my husband reacted as if he had just been hearing machine gun fire. Like, it so traumatized him. And you never would have thought that would be. So it literally became almost where we couldn't make sound in our house, which was really hard for the children. And for me, trying to work and keep the family kind of going, but also not make any noise for like 9 months. So those things, like you say, like, it affects people in a different way. It has a rippling effect, and it affects adults and children obviously very differently. So being aware of that and having the conversations, I think that's one of the things, right? A lot of people don't have the conversation. They're afraid to have the conversation because they don't want to upset the person or whatever. And, part of it is saying, okay, I know this is maybe going to be a difficult thing to talk about, but like, let's touch base and sort of talk about where we're at and how we're feeling and stuff like that, and get those discussions going. Because I think a lot of people, that's maybe part of the issue, is just not knowing how to talk about it and bring it up. And hopefully what we're doing here and having these conversations will help our audience get some ideas of how they can maybe approach that subject if they are the one who suffered the medical trauma, or if they know someone who suffered the medical trauma and can kind of help guide them. I mean, that's what we're trying to do with what we're doing here, is really give people some tools and some ideas from our experiences that can help them deal with the same or similar type issues.
And just to add to that, Mitzi, I like how you describe, I call it the solar system, where the persons on the outer rims, you don't have to discuss details with them, but those that are closer to you or closest to you in the middle are the ones that you discuss the details. And one of the most important aspects of enduring medical trauma is social support. Social support from your loved ones, social support from your friends, your associates. Those things are so important. And Catriona, we have not heard from you.
Well, I was going to comment, I guess, initially. So I'll just try to comment on everything that I was taking in. And Mitzi, like she was saying, how paying attention to your body and working in the healthcare profession, and trusting myself as well, knowing that a lot of women go to the hospital and they have symptoms and they can be different for everyone. So a doctor might, like she said, tell you, oh, you're okay, go home. Never listen to them. Advocate for yourself. You have patient rights. If you're in the hospital and you don't want to leave, like I was in the hospital once and I was like, they were gonna send me home, and I'm like, I'm not going home, and I stayed. So you have to, be a voice for your own care and know that you have that right, that the hospital is to serve you. And sometimes I guess with everything going on, people in the hospital lose sight of that. So, I mean, another strange thing in my case, sometimes I've been to the hospital and always I've been in a car accident, been diagnosed for like thyroid or, some condition. I go to the GYN. It's always another doctor that diagnoses me, for another specialist. So that's always interesting to me too. So when you go to your primary care, you're thinking that they should pick up on things, but I've always been diagnosed from a different doctor for something else, which, I do have a thyroid condition, for example, and I went to a neurologist, and I've been taking Synthroid for like, you're supposed to take that for the rest of your life. And I just trust in my body now. I don't feel like that's what I need to do. And I've been telling my doctor like to decrease what she did. And I do my own body testing, which is how your body is marvelously designed, that you can just hold whatever and just ask, like, is this good for me? You're going to go forward or backwards or stay neutral. So in a case like that, where I'm trusting my body to tell me what is good for me and not doctors. So, and I think everyone should do the same thing. And I think like in your case, and having body parts, like I had fibroids, and I don't have kids, but I still wanted to have the opportunity. And I remember the doctor told me, well, you don't need your uterus. What are you going to do with it anyway? And I just was looking at him like, like I got another doctor and I didn't have my uterus removed. But just how other people in the profession just lack empathy, I guess, when it comes to our body parts. So yeah, it's just been interesting to listen to everyone and see how when you follow your gut, how it saves it saves your own life. So hopefully those stories will definitely help other people. Thank you for sharing.
I wonder if we can sometimes gauge this, and we don't have to be parents in order to feel this way, but if one of our loved ones was in the hospital in extreme pain and the doctor said, go home, would we let them go home? No. So do we treat ourselves with as much respect and care and compassion as we do for the people closest to us? I think we have to continually remember that. When I'm even in school, I'm counseling kids, my first thought is, if this is my daughter, what am I saying? And that's where it comes from. And I think that's the same with all of us when we do anything, do we give ourselves as much compassion and care as we do everyone that we love? Because we really need to move in that direction.
Yeah, that's a really, really good point. I mean, one of the challenges, traditional, I don't mean to sort of like lump everyone together, but I mean, often women are sort of the caregiver role of, helping with the parents and helping with the kids, and in that kind of sandwich generation. And so you're so worried about taking care of everyone else that you don't take care of yourself and listen to yourself. And that's, I like a few years ago, right when sort of COVID started. I mean, I was doing back-to-back Zoom meetings and, like 10 meetings a day and just going. And then all of a sudden I was helping some people and stuff. And then all of a sudden I realized it's like, man, I'm burning out. Like I need to, schedule in some breaks into my day and not do as many meetings. And I need to block off and get some time in here for exercising, because, stopping and analyzing sort of where you're at and realizing, because it's one of those like forest in the trees things, right? Like when you're in the thick of it, sometimes you don't see it, and then you have to kind of like slow yourself down and step back so that you can assess and realize and like, okay, now what do I need to change to get things back on track? I'm going to jump in with one more thing while I think of it, which is just the different types of personalities and how they process information too, right? Because and there's all different ones out there, but driver and the DISC formula or Myers-Briggs or anything, but some different types of personalities will also process and deal with trauma differently. Like if you're a high C, you want to get all the facts and deal with it, but somebody who maybe is a driver, they just want to like get to the point and get it done and just deal with whatever the issue is and move on, right? But some spouses like to talk about whatever is bothering them, and other people like to sort of go very quiet and within themselves, and they need that time to process before they can deal with it. So it's also being aware of what that's like looks like for you, but also what that looks like for the people you're in love with, because we do process these types of things differently because of our different personalities. Like, as you can probably tell, I tend to be a talker, but when I'm stressed, when I am needing to deal with something, I just go quiet on my own. I don't want somebody babying me or looking after me, or I just need to be quiet and kind of on my own and just check in on me periodically so that I can reprocess and energize and come back. Whereas, my daughter needs that sort of holding and you to be there and that care, like she needs to sort of feel that warmth. My husband gets very quiet into himself, and he needs to just go into solitude and process it before he's ready to talk about it, right? So it's like everybody does it differently. And I think you can see with our group here, we all have different personalities. Some of us are a little bit more quiet, some of us a little more talkative, but it's all part of the puzzle of how it all comes together. I'd love to get your thoughts on that energy from some of the things that you've talked about in the past, kind of if you can put some input in there.
When you were talking, I was bringing together kind of like basically the moral of this or the theme of today's talk. And for me, it just keeps repeating: trust your instinct, trust your inner voice, and trust yourself. And the other part would be, because you actually mentioned it earlier about communication, because there's so many different personality styles and types. In order for someone to know what you need or what you may not need in that moment or in that phase, you have to communicate. You have to at least let a person know, I need a moment, or, just give me some time. Let me just go do my thing. Let me spend some time with myself. Let me gather myself together. Yeah, I need you right now. I need someone. I do not want to be alone right now. I just need to talk about it and to help me figure things out, with someone else. And as you were just saying all of those things, I was like, you have to trust yourself, know yourself, and just really take the time to listen to everything that's going on around you, internally and externally.
Really great points. Thank you.
Also, in addition, studies have found that patients who experience medical trauma, like losing body parts, also are susceptible to psychiatric diagnosis after the surgery. And I just want to point that out because it's not something that we talk about. It's not something, this is not an easy topic for women to have a round table about. And just like mental health and mental illness, it's not an easy topic. They go hand in glove because after the surgeries, because we might not be able to communicate effectively what we're experiencing and, whatever we were predisposed to prior, there is that chance of psychiatric disorder that comes after the surgery. And counseling, therapy is so important for us. And I'm saying for us, I am a Black Afro-Caribbean woman, and mental health and counseling and therapy is not something that we seek out or we were even exposed to. So it's difficult, and it is something that I promote and I encourage. Thus, you heard me mention earlier that May is Mental Health Awareness Month. It is so important for us because after surgeries, after medical trauma, it is important for us to sit with professionals I call it, I pay you to listen to me. So you just have to sit there and just listen to me speak because that's what I'm paying you for.
I find cats and dogs are great for that too. You can talk to them, they'll always listen. They don't roll their eyes at you. They'll give you a hug. So I mean, as we age, I think that's one of the reasons why people go towards having pets too, right? Is because somebody else to look after, somebody to care for, and to kind of, when you're feeling down, if you have somebody else you have to look after, it helps keep you going.
Well, that was pretty wonderful. Thank you all for your vulnerability and sharing. And I think this has been a really important conversation. I think this is going to lead to more conversation, which is amazing. So I think we'll just wrap up for today. And thank you so much for listening to the Transforming Lives podcast panel. We're so happy you're here, and we will see you again next week. And that's a wrap for the Transforming Lives podcast panel, where we strive to embrace, inspire, and empower our community.
Be sure to subscribe and download. Also, don't forget to leave a review and check the show notes for resources and contacts for all of us. Thank you for listening, and see you next time.
Thank you, Sharman.
Thank you, Cheryl.